Surface of the heart. How can I know? This is the anterior surface of the heart, and this is the posterior surface of the heart. This is the apex of the heart. The heart is located by most likely the left side of your thorax. The apex of the heart is pointing to the left hip bone. You have one question for that. The apex of the heart is pointing to the left hip bone. The base of the heart is this. It points to the right shoulder. So the base of the heart is like that, pointing to the right shoulder, and the apex of the heart is pointing to the left hip bone. Okay, what are the chambers of the heart? We didn't know that this is the right atrium, this is the left atrium, this is the right ventricle, this is the left ventricle. Okay, we need to know the vessels attached to the heart. You start with this one. It's blue in color. You make this as assuming is blue. So what is the name of that big vessel? Yes, pulmonary artery. Thank you. No vodka. You start to wake up. Okay. So this, you can name it pulmonary artery, or once it's the main item, you can name it pulmonary trunk. And this pulmonary trunk, if you follow up, it will divide into two branches, one for each lung. Pulmonary arteries. So the first thing you need to know is the pulmonary artery coming from the right ventricle going to the lung. What is that red vessel? This is the aorta. The aorta is coming from the left ventricle. It comes like this way, ascending, and then it will make an arch, and then will be descending. Again, the aorta starts as ascending aorta, going up, and then makes an arch, aortic arch, and then will go down as descending. Aorta, everybody should be tested in these three names. Gives three main big vessels. Would you write down these names? The arch of the aorta gives three main large arteries. What are these names? From right to left. This first one is called brachiocephalic. Can you write it down? B-R-A-C-H-I-O, cephalic, C-E-P-H-A-L-I-C. Brachiocephalic. Can you write it down? Okay. Next to it, we're going to have left common carotid artery. Left common carotid. Left common carotid. And then the last one, left subclavian artery. Subclavian, C-L-A-V-I-A-N. Subclavian artery. Okay? So again, the three big vessels. Brachiocephalic, left common carotid, left subclavian. So the question is that, where is the right common carotid? Where is the right subclavian? If you follow up this brachiocephalic, it will give these two main branches. But now they are on the right side. So the brachiocephalic will give right common carotid and right subclavian. But the left two are coming directly from the arch of the aorta. Left common carotid and left subclavian. So if you're asked this question, where the right common carotid and the right subclavian are coming from the brachiocephalic itself. You follow up with me? You should be tested in the three names of this arch. Okay, we need to follow up. What is that big vessel? No. This is carrying venous blood from the upper half of the body. Superior vena cava. So this is the superior vena cava. I need to see the inferior vena cava. Where is the inferior vena cava? Can you see this opening? This is the opening for the inferior vena cava. It shows this way. So big vessels in relation to the heart. One more time. Pulmonary trunk, aorta, superior vena cava, and inferior vena cava is that opening lower down. Okay? One more question. What are these branchings? Can you see blue ones and red ones? These are, the heart is a muscle. To work 24 and 7 days a week, it should have nutrition. Who is responsible for the nutrition of the heart? Coronary arteries. So the red ones are the coronary arteries. Blue ones are the coronary veins. Veins means they're going to carry the waste from the heart muscle. But arteries are carrying nutrition to the heart muscle. From where the coronary arteries are coming from? From the aorta itself. At the very early beginning of the aorta, it gives the coronary artery, and very soon the coronary artery will divide into a right coronary to the right side of the heart and the left coronary to the left side of the heart. Okay? What about the coronary veins? They carry the waste coming out from the heart. They should drain somewhere. Where is the drainage site for the coronary veins? If I have this heart from the back, can you see that straight blue line? This is called coronary sinus. Coronary sinus. What is the coronary sinus? It is the vein that will drain the coronary veins. So coronary veins carry wastes from the heart and will be drained into the coronary sinus. Okay, what else? Where this coronary sinus is going to drain this dirty blood? Into the right atrium. Into the right atrium. I'm repeating, these are tricky questions you are going to be tested on. Coronary veins drain into the coronary sinus. It's the landmark to the posterior surface of the heart. If I give you this heart, where is the anterior surface? Find the coronary sinus, is not there. Turn it to the back, hey, this is the coronary sinus, so this is the back of the heart. Okay? Now, time to open the heart and see what's inside it. When you go to the heart from the inside, let's use this one. This is the wall between the two ventricles. It's called interventricular septum. The wall dividing the two ventricles. Interventricular septum. If you go up here, these are the two atria, right atrium and the left atrium. Right atrium and the left atrium. Lower down, right ventricle and the left ventricle. The wall in between is called interventricular septum. We have the same wall between the two atria, interatrial septum. Where are the valves inside the heart? If this is the pulmonary artery, at the very early beginning, you find the valve. Here you go. This is the pulmonary valve. Can you see it? Pulmonary valve. Where is the other semilunar valve? Aortic valve. Where is the aorta? It's this one. I need to see the very early beginning of this aorta. It should be here. Can you see it? Don't miss that aortic valve. It's deeply located. It's deep. Look at this. This is the aortic valve. Lower down deep this way. So here is the pulmonary valve, and here is the aortic valve. Where are the other two AV valves, the tricuspid and the bicuspid? Let's go for the first one, tricuspid valve. We have the tricuspid valve is surrounded by these cord-like structures. Can you see these white things? These white things are called corda tendini. Corda tendini. What are these? These are fibrous bands to make firm closure of both the tricuspid valve and the bicuspid valve. Corda tendini, these white cords, are attached to these small muscles. Can you see these small muscles? On this side and on that side. These are called papillary muscles. Look at these. This is one papillary muscle, and this is one more papillary muscle. So chordae tendineae coming from the valve are attached to papillary muscles, and where the papillary muscles are attached to the walls of the ventricles. Can you see it? This is one papillary muscle attached to the wall of the ventricle. One papillary muscle attached to the wall of the ventricles. We have one more thing, only found in the right ventricle. Only found in the right ventricle. What is that? If you look at the right ventricle here, I have something running across called moderator band. Moderator band. It's only found in the right ventricle. This thing running across the right ventricle. That's it for the heart. This is the heart mannequin. Okay, I missed one more thing. What are these two red vessels? You remember these two? Actually, they are not one and one. They are two coming from each lung. What are their names? Pulmonary veins. So these red, two from the right lung, two from the left lung, called pulmonary veins, carrying the clean blood from the lung back to the left atrium. That's it.